In the fourth section of the lecture, now we will talk about the localization of facial lesion. In this, we will talk about the central and peripheral facial paralysis, topo-diagnostic tests, and complications following facial paralysis. Localization of facial lesion, central facial paralysis. If the central facial paralysis is present, the most important is the preservation of forehead and brow movements are present, like frowning of the forehead and all these movements and movement of the eyebrows, they are preserved and they are not lost. So forehead movements are retained due to bilateral innervation of frontalis muscle. If it's central injury of the facial nerve, because the supply of frontalis muscle that is responsible for the movement of the forehead and eyebrows, so frowning of the forehead and the movement of the eyebrows is present because they have the bilateral nerve supply. Caused by cerebrovascular accident, CVA, hemorrhage, thrombosis or embolism. If there is rupture of the cerebral vessels due to high blood pressure or any other reason, and there is hemorrhage, rupture of the blood vessel, or if there is blockage of the blood vessel as a result of thrombus or embolism, it can cause central facial paralysis. Tumor or abscess can also lead to central facial paralysis here. This is loss of nasolabial fold and drooping of lower lip. Then peripheral facial paralysis. What happens in peripheral? To differentiate most important point, there is loss of no frowning of the forehead here in the peripheral facial paralysis, while in central facial paralysis that was preserved. So peripheral facial paralysis, lesion at the level of nucleus. There is paralysis of sixth nerve, lesion at cerebellopontine angle affect fifth, ninth, 10th and 11th nerve, lesion in the bony canal, lesion outside the temporal bone affects only the motor functions of the nerve. And this is the facial paralysis in peripheral lesions, inability to close eyes and drooping of eyelids, loss of nasolabial fold, but in this there is loss of forehead and brow movements also. So different levels of lesions affect different nerves. At the nucleus affect the sixth nerve. At the cerebellopontine angle affect fifth, 9th, 10th and 11th nerve, and then at the temporal region it mainly affects the motor functions of the nerve. Next, topo-diagnostic test for lesion in intratemporal part. Here again you see these are the taste fibers, green, then we have motor fibers which are blue, and then the secretomotor fibers which are red. This is the stapedius, this is the sublingual and submandibular glands and motor fibers to the face of the facial nerve. This is the course of the facial nerve. These are some tests that can be performed. We have Schirmer test, stapedial reflex or acoustic test. Then we have taste test to put different things on anterior 2/3 of the test and find out if the patient can tell you what the taste is. And then also submandibular salivary flow test. So Schirmer test is the test performed for the tear formation, and all these are the tests used for the diagnosis of lesion in the intratemporal part of the facial nerve. Complications following facial paralysis. Incomplete recovery. Most of the time it is completely recovered, but there are chances that it might recover incompletely. Exposure keratitis, because of incomplete closing of the eyes, it can cause exposure keratitis. Mass movement known as synkinesis, mass body movements, tics and spasm present, contractures, crocodile tear, which are gustatory lacrimation, and Frey's syndrome, gustatory sweating. Gustatory lacrimation and sweating, these are the lacrimation and sweating which is present after eating. So increased lacrimation and sweating, profuse sweating after eating, this is one of complication of facial paralysis. Psychological and social problems can also be present. So all these are the complications after the facial paralysis. Incomplete recovery, tics and spasm, contractures, gustatory sweating, gustatory lacrimation associated with feeding or eating. That was all about fourth section. Thank you for watching sqadia.com.